Milwaukee County, but also the challenges that we're currently facing because of COVID-19. As you all are aware, Milwaukee County is ranked 71 out of 72 counties for health in the state of Wisconsin. And we know that the differences in health outcomes are a direct result of a set of health determinants like income level and educational attainment. And we do know that the pandemic has only exacerbated these issues. We know that 60% of the total confirmed deaths since the start of the pandemic have been African Americans. I mean, they also make up about a third of the confirmed COVID cases here in Milwaukee County. And because we've had to make dramatic steps in order to stop the spread, we've seen our economy contracted. We've seen businesses have to adapt or shut down during this pandemic, or we've seen how people have had to change their work environment in some type of capacity, reduced hours, working from home. And many people have actually who are actually exposing themselves even more through their job, and those who have actually lost their job entirely. The dramatic disparities have highlighted by this pandemic show the deep inequities that have existed. And these disparities exist not just because of these disparities don't just affect those with historic lineage to slavery, it affects all people of color. And while COVID-19 may be new to us, again, the disparate racial impact of this virus has been deeply rooted in historic and ongoing social and economic injustices. The persistent racial disparities in health status, wealth, employment, housing, poverty, to name a few, all contribute to the greater vulnerability to the virus economically and physically. And so we understand that, and we must understand that we are one county stronger together, and together we have the power to make the change. And we're shifting our focus upstream on strategies that prevent poor outcomes for everyone in Milwaukee County. And I believe that we're well positioned to achieve this bold vision. And we're addressing our own policies and practices upstream so we can improve those services for everyone who needs them. And so if you want to hear more about what we're doing in our strategic focus areas, please visit my YouTube channel or visit our Milwaukee County website for more details. Today is also voting day, and I know the mayor may touch on this a little bit more, but I want to make sure that everybody gets out to vote, as well as making sure that you fill out the census form as well. And with that, I'd like to hand it over to the mayor.
Thank you, Mr. County Executive, and thank you for your work on racial equity. I think that you're obviously doing what's really, really important to the residents of our community right now. What I want to talk about for a little while is the issue of reopening our schools. We've gone through a lot of work here in the city of Milwaukee, and I will be giving a lot of credit to our health department as I do this, as to how we carefully and correctly reopen our different institutions. So even before Milwaukee had its first case 5 months ago, we knew we needed to set the stage for a thoughtful and science-based guidance for keeping Milwaukee safe. And among the most important people that we needed to protect clearly are our children. So the reopening of school during the COVID-19 pandemic is a complex process, as there must be many considerations, not only for safety, but additional circumstances involving economic hardships, social isolation, and nutritional and developmental wellness. Education, as we all know, is a vital component to communities and impacts our overall health and well-being. It's also important to acknowledge the importance the schools themselves play as they serve as a resource for public health interventions by addressing core needs such as nutrition, access to health, social support services, engagement, and support of families and the community as a whole. The team of people inside and outside of city government has delivered the guidance that schools will need to move forward. That guidance will be released later today by the Milwaukee Health Department. I want to thank all the people who've been involved in helping us reach this consensus. Obviously, the Milwaukee Public Schools were able to reach a decision several weeks ago. Our health department has been working very, very closely with other schools throughout the area to make sure that as they seek to reopen, they're doing so in a thoughtful and safe way. So there will be three different components that will be required. One is to have a plan for a full virtual, one is a hybrid, and one is in person. And what we are asking the schools to do and what is expected of them is to submit their plans to the Milwaukee Health Department for their review. And they will review these plans. And again, these will all be released later today so that people will have an opportunity to see exactly what to do. But I want to make a point that goes beyond that, because as we now are in our fifth month of this crisis, this pandemic in our country, we have seen essentially a failure at the federal level to really act. At the state level, we've seen a paralysis, and the paralysis has been caused in large part because of the refusal of the legislature to become engaged in this issue in any fashion, in any responsible fashion whatsoever. What does that mean? That means that all of this has been left to our local health departments. And here in the city of Milwaukee, where we have had a disproportionate number of deaths among our African Americans, where we've had a high incidence of COVID-19 positivity findings for our Latino population, we know that those individuals that are most susceptible to this and who have historically been the most hurt economically are the ones that are most at risk. And so we as a city have worked, and I say specifically our health department has worked incredibly long hours to try to do what is necessary to help nearly 600,000 people here in the city of Milwaukee. And so I want to give them a lot of credit because they have worked overtime, and I mean weekends, I mean nights, to make sure that we have a thoughtful reopening of our churches, that we've had a thoughtful reopening of our bars and restaurants, that we've had a thoughtful reopening of our retail establishments, our daycares, our preschools, hair salons and barbershops, our athletic clubs, our gymnasiums, gatherings, whether they're funerals or weddings. Our health department, our local health department has been asked and required to do work that you would think would be done at the federal level or at the state level. But because of the absence of any meaningful and positive guidance from those levels of government, our health department has been the ones that have been forced to really come up with this. This is something new for our health department. We have never operated in a pandemic before. And so now here we are, basically in mid-August, being required to come up with plans for the reopening of schools. And we're happy to do it. We know that that's our obligation. But you put that along with the work that we've done with the universities, with the preschools, with the daycares, with all the churches and bars and restaurants, and you can see that this is a tremendous burden that's being placed on our local health departments. So I want to acknowledge all the people who work in our health department, from Commissioner Kowalik on down, who have put in long, long hours. It's important that everyone sees his or her role in getting us back to a more normal life. It's important for our health, our economy, and our children. And a lot of people are working very hard to protect our residents in this very, very significant and dangerous time. So with that, I'm going to turn it over to Dr. Weston, who's done a tremendous amount of work as well. Dr. Weston.
Thank you, Mr. Mayor. I appreciate that. Good afternoon. First, as always, to our numbers, we have 20,284 cases of COVID-19 in our community and 394 individuals who've died. Overall, we're seeing promising trends in our county. We're having a downtrend in cases and hospitalizations, and an apparent downtrend, or at least a stability, in our positivity rates. On the more concerning side, we are seeing a downtrend in individuals choosing to seek out testing throughout the county. And this is particularly in the more southern municipalities in the county. So for no matter where you live, if you have symptoms of COVID or if you have concern for COVID-19, it's essential that you get tested and know your status so that you can avoid transmitting the disease to others. Today, there's a few questions that came from community members that I thought would be worth taking a few minutes to address. I think there are common questions that I've heard from a lot of folks over the last weeks and months. So first, a question about masks. A woman from Shorewood asked, when I wear a cloth mask all day long, I get worried about breathing bad air. Is it really safe to do this? I hear this question come up a lot. There's different varieties, sometimes concerns for bad air, sometimes concerns for lack of oxygen or breathing in too much carbon dioxide with a mask. To be clear, this should not be a concern. There's a myth that you don't get enough oxygen breathing through a cloth mask. It's just that, it's a myth. Oxygen and carbon dioxide exchange easily through a cloth mask. Next, on a related note, a woman from the city of Milwaukee asked, when gathering with a small group outside, is it really necessary to distance or to wear a mask? So we know that being outdoors is safer than being indoors. The open air is always circulating, and really any level of breeze helps to dissipate the aerosolized virus and the droplet particles. That said, when physically close to someone, you'll still inevitably inhale the air that they're breathing out. That's why physical distancing is still important, and wearing a mask when not able to appropriately physical distance is still critical, even outside. So I've seen many gatherings in open areas where everyone sits in a circle, they're spaced apart to visit with each other. This is a great way to physically distance without having to socially distance. Third, a young man in Brookfield, a bit outside of our county, asked if it's likely, he said, is it likely that I can contract COVID while at the gym, even if everybody there was wearing a mask? So with gyms, unfortunately, the combination of an indoor space, heavy breathing, and often closely spaced equipment can make gyms environments where transmission can certainly occur. Now, that said, if everyone's wearing a mask, if the equipment and the people are spaced out by a minimum of 6 feet, if there's reasonable airflow and there's good cleaning practices in place, the risk of transmission can at least be minimized, though it is still certainly present. But masks and physical distancing are essential. And the last question for today, a woman from Wauwatosa asked, should I still be limiting the number of times that I go to the grocery store like I did in the beginning of the pandemic? So we know that COVID-19 is widespread in our community, no matter where in the county you live. And for that reason, we want to continue to minimize being in crowded environments. Grocery stores throughout the county have done a great job of adapting to this new normal and encouraging physical distancing, mask wearing, and good cleaning practices. That said, it's still important to minimize your exposure to places with lots of people, including the grocery store. So while the old grocery store, the daily trip to run and pick up a few items is not ideal anymore, weekly stocking up is certainly reasonable, especially if you follow the state and some local orders and wear a mask and physically distance as much as possible. So in summary, the ongoing theme here is that what we've talked about before: people, space, and time. Minimize those you interact closely with outside of the home, expand the space in which you interact and wear a mask, and minimize the time that you're interacting closely. We all know that we must make changes to our everyday behavior to best promote the health of our community. County Executive Crowley yesterday at his vision address outlined the county's values of influence, updated values of influence, integrity, and inclusion. We can work to influence those around us as role models in community wellness. We can demonstrate integrity through responsible health behaviors, and we can be inclusive by reaching out to those around us and those facing struggles in these challenging times.